what should the patient pay attention to in terms of diet for ovarian maintenance?
Okay, depend on what you're looking at, from the Western point of view or Eastern point of view. As a matter of fact, I don't know much to say about Eastern point of view. We talk about the yin and the yang of the diet, But from the Western point of view is in general, a balanced diet. First of all, a healthy diet, right? So as long as you eat a healthy diet, meaning, that key thing for me is that you try to avoid anything like alcohol, anything like smoking, no cigarette, right? And that's enough for me, right? But however, be healthy, meaning that from the Western point of view, that is the balance of the three components, protein, fat, and carbohydrate, and also there's some fiber, high fiber diet in there. Now, particularly for women who want to have a better quality of egg, research here show that actually you need to have a little bit more protein and fat. Patient who eat only vegetable like vegan, it's not really very good for egg quality. But on the other hand, don't eat too much of fat. Mainly high protein diet. We see that two things: the egg quality is better, and not only that, we'll be having less side effect during the stimulation egg retrieval later on.
Why coenzyme Q10 must be taken daily, and what is the health benefit to ovaries?
Okay, let me tell you the benefit of CoQ10. In general, it helps for everybody, not only for women in the reproductive age. Even myself, I put myself on CoQ10 as well. The idea is CoQ10 involved into the energy producing of the cells. For example, the heart. The heart needs a lot of energy to pump. And then the other thing also that we talk about in the egg and the sperm, in particular sperm moving. So anything moving needs energy. So there you go. It needs CoQ10. So that's the reason why I highly recommend CoQ10 in both husband and wife who plan to have a baby. Now, not only that, we need higher dose of CoQ10. We talk about 200 milligrams 3 times a day in order to be beneficial.
Is DHEA is essential for everyone?
The other element that I would recommend, yes, truly DHEA, number one, because all of us, as we get older than 30 years old, the DHEA level drop. And research show that if we give the patient supplement of the DHEA, patients tend to be younger, healthier in the long run. That the research confirmed that. And in the female, actually, DHEA is a neutral hormone. When you take the DHEA, it will convert into the estrogen in the female and will convert to testosterone in the male. So we call that it is a neutral hormone. It's like an ingredient that the body will use it whichever way to be beneficial. So research show that actually in men, when they take DHEA, the testosterone level is going to be much better, sperm quality better. And likewise, in women, we see that the stimulation much better later on.
Besides coenzyme Q10 and DHEA, can you recommend some other supplements that healthy for our patients?
In general, let's talk about men first, because we see that CoQ10 and DHEA help with the sperm quality. In men also, there's another supplement that I highly recommend that is zinc. When you take zinc, the reproduction of the sperm will be much better. So that's why, in general, we recommend a multivitamin for men, but particularly have to have zinc in there. And for women, of course, we recommend a prenatal vitamin. The main component we need is the folic acid. Folic acid will prevent any birth defect later on the baby. And the other thing in multivitamin, prenatal vitamin for female is that magnesium. Magnesium also involved in the hormone reproduction. So that's the two components essential for both men and women.
What are the benefits of acupuncture smoked moxibustion for ovarian maintenance? Is it right for everyone?
Well, that's an interesting question because it's very controversial as a matter of fact. Like I say, it's similar to any Eastern traditional medicine. A lot of things we don't know what the effect of the acupuncture, for example. However, some studies say that 60% say that there's improvement in the fertility, but 40% say, well, there's no improvement. But at least, 0% say that it's harmful. So from my point of view, that it's all right, that you can continue this treatment. Whatever the treatment that you believe will improve the outcome, I highly recommend it. Some studies show that the treatment improve the blood flow to the ovary and also that improve the fertilization rate, but yet that's to be proven. So take it at your own choice.